Hi, my name is Serena Johnson. This video covers a cultural diversity activity plan to teach counseling techniques and interventions that are most effective when counseling clients who experience poverty. First and foremost, a little bit of background about poverty. People who are impacted by poverty often experience difficulty in providing stable housing, income, food, education, transportation, or health care for themselves or their families. Having limited access to these basic needs and necessary resources inflicts on all levels both mental and physical strain, most of which goes untreated by health professionals. According to the 2019 National Survey by the U.S. Census, as much as 10.5% of the U.S. population is categorized as living in poverty. So in other words, 1 out of 10 people pretty much experiences poverty on a daily level. There is a huge need for counselors to provide specialized and competent services to this population. However, there are a lot of areas that counselors need to cover to be considered competent. This image here shows one approach to counseling poverty called grounded theory. This theory, developed by Madeline Clark, essentially combines the multicultural competencies outlined by David and Daryl Wing-Sue in their multicultural and social justice competency model, and it adds specific techniques and interventions to make the theory applicable in practice with clients. So this graphic here shows an integrated approach that utilizes training and awareness, knowledge and skills, and advocacy. This diversity activity plan will be a 4-hour-long workshop in the day, with each hour covering the different areas of competency. The goals for this workshop will be for the counselors to become better advocates for their clients in poverty, be multiculturally competent in training, awareness, knowledge, and skills, and demonstrate effective skill levels in poverty-sensitive assessments, person-centered relational skills, cultural broaching, and strengths-based empowerment. First, I want to break down the first area of training and awareness of the grounded theory model. Because the problems presented with poverty are often complex and intersectional, counselors need to first undergo both formal and informal training on areas of experiences with poverty and multicultural sensitivity before being considered competent. Clark defines formal training as including activities such as university-level programs, continued education, or seminars on poverty, or participating in research on poverty. Informal training is a little more lenient, and it can consist of personal or professional experiences of interacting with poverty-stricken communities or people. So for the first hour of this workshop, counselors will watch an educational lecture on the effects of poverty and its origins in our society. Counselors will learn which populations are most affected, and what mental health effects are most observed in these populations. To assess the training, counselors will be tested on the covered materials as well. Hand in hand with training is awareness. Our graphic shown earlier states that there are 3 areas of awareness that counselors must understand: self-awareness of social class identity, the client's worldview of social class identity, and counselor boundaries and wellness. So firstly, counselors need to demonstrate awareness of how their own social class may be attributed to the systemic power imbalance of society. So for example, if you as a counselor are living in a suburb in a house that you own or you're paying the mortgage for, you need to acknowledge that you are benefiting from a middle-class life experience. You as the counselor will also need to acknowledge that the social class identity of your client, who, if they experience poverty, will not be able to relate to your middle-class experience and may struggle with housing insecurity or even homelessness. Counselors must also demonstrate awareness of how systemic power, privilege, status, race, and oppression all might shape their own beliefs and values in the counseling relationship, and be aware that these beliefs do not influence the way they interact with the client. So for this next hour in the workshop, counselors will demonstrate their self-awareness by completing a survey that asks them to check off which privileges they have access to. So things like access to healthcare, or access to a car to get to work, or access to clean water and food. All of those things will be listed on this questionnaire. The results of the individual questionnaires will be compared to the statistical living standard of a person living in poverty. So it's my hope that this activity will help illustrate to the counselors how their social class affords them privileges people in poverty may not have access to. Next in the grounded theory approach is the competency of knowledge. Clark states that the best practices were expressed in 5 subthemes: complexities and barriers of poverty experiences, privilege, oppression, and intersectionality, systems theory, severe and persistent mental illness, and crisis and trauma. These are specific theories that shed light on the power differentials and imbalances that shape our society and the mental health effects it has on our population. Knowledge in these areas allow insight into what social justice or multicultural counseling steps, interventions, and skills are individually necessary when working with these clients. So for the next hour of our cultural diversity activity plan, counselors will be given a brief lecture on different areas of these knowledge. To assess this activity and what the counselors have retained, again, they will be tested on this knowledge and compared with each other. Moving on to the skills aspect of this theory, there are many interventions and techniques used in working with people in poverty, but I'm going to focus mainly on poverty-sensitive assessments, person-centered relational skills, cultural broaching, and strengths-based empowerment that were displayed in the infographic. So firstly, a little bit of background about each of these skills. Poverty-sensitive assessment. This is a method of evaluation for clients that includes the full context of poverty and its experiences. The assessment is individually tailored and takes into account how poverty affects the client's daily life. So life aspects that are impacted are measured in ways of food, housing, financial security, access to health care, availability of transportation, and these are all measured through diagnostic assessments or patient intake information forms. This assessment is essential because it allows the counselor to understand a more complete picture of what basic needs first need to be met within the client before they can move on to tackle the issue of mental health. Next is person-centered relational skills, which basically boils down to developing a strong relationship with your client. This is a foundation in many forms of counseling, but here practicing empathetic listening, building connections, and being honest with your clients will help to build a cooperative relationship that is based on trust. And this strong, positive relationship will allow your client to share more of their experiences and feel more comfortable. Next is cultural broaching, which is a technique where counselors identify differences in the cultural identities and values between themselves and the client in order to open an honest conversation. So first, the counselor must be aware of their own assumptions or value ideas about social class differences and must be willing to address these assumptions with the client. The client, in turn, will feel acknowledged and empowered to participate in the discussion in relation to their experiences with poverty. So this will also help build a cooperative relationship between the counselor and the client, and it helps both parties to understand each other better. Lastly, recognizing strengths for client empowerment is another important skill. Recognizing client strengths and skills is extremely helpful in empowering the client to feel more in control of their lives despite their daily experiences. Counselors can use this technique to acknowledge positive outcomes in a client's life, highlight their resilience, congratulate personal successes, all in order to empower clients about their personal strengths and abilities. This empowerment is really important to instill in clients because often in their daily lives they experience feelings of powerlessness and frustrations due to the systemic nature of the problems that come with poverty. So for the next hour of our workshop, counselors are going to practice utilizing these skills that they've just learned by working with the person sitting next to them. Their partners are going to assess how effectively they practice these new skills by completing a short survey and vice versa for their partner. This activity will help counselors better understand how to effectively recognize when and how to use these skills when working with a client in poverty. So again, just in conclusion, the goal of learning these skills and competencies will be for counselors to become better helpers and advocates for their clients in a more multicultural sense. A counselor who is multiculturally competent will be able to, for example, help their clients recognize the effects of their own internalized oppression and how that oppression may have guided their thought process and actions. They might be able to also highlight the ways that systemic power differences affect their clients' lives in the form maybe of discriminatory school zoning or culturally targeted workplace dress codes, just to name a few examples. A multiculturally competent counselor will be able to aid in helping their client gain access to community resources and programs for food, housing, clothing, and health services. Counselors who keep in mind the complex integration of systemic power and culturally relevant issues and its effects on a population will be in a better position to help and advocate for their clients. All of these techniques and interventions combined with the competent utilization of awareness, knowledge, and advocacy all work towards the goal of giving a voice to people who are disenfranchised and unempowered by the systemic effects of poverty. This intersectional and multicultural approach is one more step towards ensuring that the availability of counseling services can be accessible to everyone who needs it. And our goal of this cultural activity diversity plan is so that people can better understand these and better help their communities.